HRT is hormone replacement therapy. So every one of us has hormones in our body, and there are certain times in our life when we lack hormones or they're not balanced. So it's really important for us to check them, even from the time we're 16, 15, years old, all the way up till the day we die. Every single organ in our body has hormone receptors. That's why it's so important to make sure that we're balanced. Well, when you come in, you first want to do a consultation, and during the consultation, we'll find out what is it that's ailing you. What are you having symptoms of? What needs to be fixed? Are you tired? Are you lethargic? Are you having a low libido? Are you having hair loss? Are you having a lot of acne, back acne, facial hair? Men, are you having erectile dysfunction? There are so many different reasons why we need to regulate our hormones, but we come in, ask those questions during the consultation. We get our blood drawn. When you draw your blood, it takes about 2 days for it to come back. You come back in, we do the lab review, review everything from head to toe. So it's a very comprehensive panel that also will review things like your cholesterol levels, your cortisol levels, your thyroid, your hormones, your CBC, CMP, so electrolytes, vitamin deficiencies, etc.